In a world of constant political battles, we've recently seen one point of bipartisan agreement.
Last year, Governor Patrick called opiate addiction a public health crisis. He was right. It is a crisis. It's one that cuts across every community in the Commonwealth.
Heroin and prescription drug abuse are taking lives every day. A couple of weeks ago, I announced that this will be a priority for my office. We will work to improve our prescription monitoring program, educate prescribers, go after drug traffickers and pill mills, and expand access to recovery and treatment programs.
Members of the governor's task force on opiate abuse will issue recommendations to him next month. But in Boston, yesterday marked the 6-month anniversary of the closure of Long Island, including the homeless shelter there and several treatment centers, leaving hundreds without a place to go. Joining me now to talk more about that are Lynnel Cox, whose son was one of the people who'd been getting treatment on Long Island when it abruptly closed. Jonathan Scott is president of Victory Programs that helps homeless people, those with substance disorders, and used to treat people on Long Island, amongst other places. Good to see you both. So, Lynnel, starting with you, scores of people who are in recovery there, like this, displaced. Where are they all now?
So that's one of the problems. We don't know where they are because when they were released from the island, nobody took the time to maybe ask where they could get in contact with their next of kin or something like that.
Where's your son now?
My son is actually doing very well, thank you, in a program in Florida. He needed to leave Massachusetts to do that.
But immediately after, I remember you on here on this show months ago, immediately after you didn't even know where he was, right, for a couple of weeks, no contact, no nothing, right?
That's right, which is something that often happens.
So on the homeless front, hundreds displaced. Marty Walsh has said all the right things, appears to care about this, as he does about recovery. He's in recovery. Right. What's the status of housing homeless people who lost a place out on Long Island?
Well, I think one thing that people don't understand is it can take years to sometimes open up a group home or a treatment program. So what we lost on Long Island was catastrophic.
How many people? How many beds?
At the night of the evacuation on October 8th, there were about 700 people out there. During the winter, there could be up to 1,200 people. You probably had a dozen different agencies, and all of them are in different places now, trying to site, trying to regroup, and trying to reestablish themselves in Boston.
And Marty Walsh, I know, said there were going to be, 490 new beds by the end of April. And my sense is it's not for lack of trying, but they're not quite there yet, right? The numbers are pretty low, in the 100 range or something?
Yes.
So where are those people? I mean, what happens to those hundreds of people who finally found a home, even if it was a temporary one? Where are they now?
Well, I get 60 phone calls a day in a women's treatment program I have in Boston for one bed available a day. So people are just really not out there, and they are struggling to try and find places.
You know, Lynnel, somebody who's been in a recovery program, I saw particularly some of the women I've seen on television who have talked about what this program meant to them in the most intimate, visceral kind of way. What happens when you don't have that program for a week or a month or whatever?
Right. So my organization, Hand Delivered Hope, we perform street outreach. So we go out into the streets once, twice, 3 times a month, whatever the need is. And I can tell you that we see a considerable increase in the numbers of people, young, old, women, pregnant, people with cancer, people with heart disease, and particularly over at the Night Center is where I see the largest numbers of people turning out in the lines, and people they're starving. I mean, we provide them with a small sandwich and water, but particularly on our last delivery, I have never had so many people approach us. We brought out 200 sandwiches, 200 bottles of water. Really approach us. Do you have any water? Or do you have any food? I mean, there's just not enough that we could bring to them, because although we have established these 100 beds, there haven't been any increase for beds for women. Although we have the Night Center, they're not given any food. They're sleeping on the cement slabbed floors there. They're not even allowed to bring a blanket.
You know, I think you captured the essence of this. I read a quote from you a while ago after there was an effort to move some of these folks to Roxbury. Obviously, there was community opposition. You said someone shouted at a community meeting, "We don't want those garbage and trash people in our neighborhood." There's no constituency, right? I mean, what's so odd to me, Jonathan, if I can, usually when people like you are saying we're not people are not taking care of their fellow men and women. A governor doesn't care, an attorney general doesn't care, a mayor doesn't care. We have 3 leaders in this state who I think in their hearts, I think you'd agree, care about this stuff. Where's the disconnect? Why is this falling apart? Why has it been so long that people are going without?
Because I don't want to paint the picture that they're heroes and villains here. I think we have leaders, and a leader's job is to really help connect, to help tie people together and to make the connections, to make projects and things work and put things back in order again. And I think that we are struggling now with so many things that need to be connected from all levels of government. So we have a new governor now who's said the opiate emergency is a #1 priority for him. Hearing after hearing, people are saying we need more beds, we need more beds, we need more beds. And I hope the governor hears that and that they recognize how important Long Island was to the Commonwealth.
Didn't he cut funding for homeless prevention in his budget?
Yes, there were cuts.
So how do you match that up with the rhetoric? Because I've talked to him a lot. I think he does care about it. How does that connect to all this? I know you don't want to blame, but I mean, ultimately, someone has to address the needs.
I would like to say that I think that the city and state, there is a serious disconnect, and I don't think from day one the city took the time to get in touch with the state and figure out how they could help them. I think that the public safety agencies, I think that lots of people could have had their hands in this if they were just asked. I think that some miscommunications have gone from the city up to the State House, and I think that the state would help if they had the right information and the ask was there.
But don't you think, we only have 30 seconds left on it, isn't it part of what Jonathan said at that meeting? It's those people. I mean, it's those people. I know it's your son, and if it's their son or their daughter or their wife.
It could be anyone's son.
But do people believe that? I know intellectually they do, but
it's a lack of education, which is something else that we need to work on here in Massachusetts.
I hope you do, and you've been doing great work, both of you. How do people want to get in touch with your organization? How do they find you?
Sure, they can find us on Facebook at Hand Delivered Hope, or they could call our Hope line at 774-565-4434.
And Jonathan, how about you?
Victory Programs is 617-541-0222, and we have programs all over the city that can help people dealing with addiction issues.
Lynnel Cox, thank you so much.
Thank you so much for
having me. Thank you so much.
Hope people are listening.